So we'll be looking at the AP joint mobilization of the shoulder. So with a lot of our assessments, they can turn into intervention, but we'll talk about assessment first. So what we want to do is okay, Dr. Diaz, can I have you scooch just a tiny bit? Okay, I just want his shoulder a little bit off from the table. So that way when I do the posterior glide, I'm not running into the table. He has some room to move here. So orientation wise, he's in relative neutral-ish, maybe about 30, 45 degrees of abduction. And as you notice, even with my right hand, his elbow is slightly higher than the level of the humeral head. Because if the elbow is lower than the humeral head, or if their pecs are really tight, that can pull them more anteriorly, what will happen is the humeral head will sit in a more anterior position, and that can create a little bit more impingement. So if the elbow is a little bit higher, the humeral head sits in the glenoid a little bit better. And let's see, sorry, Dr. Diaz, can I have you scooch up just a tiny bit? Thank you. So that way you can see how I have his arm cradled. He hopefully feels pretty supported. So more points of contact will let the patient relax a little bit more. So what I'm going to do is with my left hand, I'm going to find the end of the AC joint, and with the hypothenar part of my hand, I'm going to be weight shifting down in a posterior but slightly lateral direction. And the reason being is the way that the glenoid is oriented. It's not facing completely this way. It is slightly angled at a 30-degree direction in the scaption plane. So you want to take up the slack of the tissue and then weight shift down, find R1, R2, R1, R2. I'm in a staggered stance. So that's your assessment, and then when you do the mobilizations, you just grade accordingly. So if it's a grade 3, take up the slack and weight shift down to 50% and provide your mobilization there. Now, when you assess, you can have them in a neutral position here. He is in slight abduction. You can assess at 90 degrees. So when you do that, and he's in neutral rotation, you might feel that the joint will be a little bit tighter because you are winding up the joint a little bit more.